You know those microscopic things you usually don't give a second thought to? Well, turns out some of them can cause surprisingly big trouble for our beloved dogs and cats.
Yeah, leading to some pretty unpleasant digestive issues, unfortunately.
So today we're taking a deep dive into one of these tiny agitators, Cryptosporidium.
That's right. We're zeroing in on cryptosporidiosis, which is the illness this parasite causes. It's mainly a gastrointestinal thing.
Gotcha. And we've gathered some good info for this deep dive, right? To help pet owners, really anyone interested in animal health, figure out what's going on.
Absolutely. We want to cut through some of the jargon and get to the heart of it.
Okay, let's unpack this Cryptosporidium thing. Our sources call it an epicomplexan protozoan. That sounds, well, pretty scientific.
It does, doesn't it? But think of it as a very specific type of single-celled organism, a parasite, essentially.
Okay, a parasite.
And it has a unique way of infecting cells. What's also key is that it's found pretty much everywhere in the world.
Everywhere.
Yeah, and its entire life cycle happens right inside the intestines of animals. It's an enteric life cycle.
So this parasite's life is all about the gut. How does it actually get in there and, start causing problems?
Well, infection kicks off when an animal swallows something called sporulated oocysts.
Oocysts, like little eggs.
Kind of. You can picture them as tiny, very tough, protected packages containing the infectious stage of the parasite.
Okay.
Once they're inside the intestine, these packages break open. They release sporozoites.
Sporozoites. Got it.
And these sporozoites then actively invade the cells lining the intestinal wall.
Ah, so they're like the initial attack force. What do they do once they're inside those gut cells?
They start multiplying, asexually actually, making copies of the cells right inside those cells.
Okay, so they're reproducing.
Exactly. Then they develop into another stage called merozoites,
Merozoites.
which are then released to infect even more intestinal cells. So it's like this cascade, a domino effect spreading through the gut lining.
That sounds efficient, in a bad way.
It is. And we also learned that in cats, it typically takes about 5 to 10 days from that initial infection before the parasite might be detected or signs of illness might appear. That's the pre-patent period.
5 to 10 days, that's pretty quick. Now, our sources also hinted that the severity can really vary.
Oh, absolutely. That's a crucial point. In animals with strong immune systems, the infection usually just stays put, confined to the intestines.
Okay, that's good.
But, and this is where it gets, well, more concerning, in animals with weakened immune systems, this parasite can potentially spread beyond the gut.
Spread where?
It could affect organs like the liver, gallbladder, pancreas, even the respiratory system sometimes.
Whoa, that's a much more serious situation then.
Definitely. A huge difference in outcome potentially.
And this isn't exactly a rare thing, is it? I think I saw something about cats in the U.S.
You did, yeah. Serology studies, those look for antibodies which show past exposure. They found that around 15% of cats in the United States have been exposed to Cryptosporidium at some point.
15%, that's quite a few.
It is. So while most of these cats probably won't show symptoms, it really underscores just how common this parasite is out there.
Which makes understanding how it spreads really important, right, for
Yeah.
prevention.
Exactly. Especially for preventing active infections in those more vulnerable animals like young kittens.
Okay, so exposure is relatively common, but who is actually at the highest risk of getting sick from it?
Right, because exposure doesn't always mean illness. When we look at dogs and cats, it seems neither sex nor breed really makes an animal more likely to get cryptosporidiosis.
So any breed can get it.
Seems so. But age is a really significant factor, particularly in dogs.
How so?
Well, almost all the clinical cases we actually see in dogs, the ones showing symptoms, are in puppies that are 6 months old or younger.
Really? Just the young ones?
Mostly, yeah. Interestingly, though, older dogs can still carry the parasite and shed those oocysts in their feces without ever showing any signs of being unwell themselves.
Wow, so they could be silent spreaders without anyone even knowing.
Precisely. And it's similar for young kittens, those under 6 months old, are also much more susceptible to developing the full-blown illness.
Okay, so young animals are the main concern for actual sickness. We know how they get it, who's vulnerable, what are the red flags, the signs a pet owner should watch out for.
Well, the key thing to remember is that many infections are actually subclinical.
Meaning no symptoms.
Exactly. Your pet might have it and you wouldn't know. But when they do show signs, the most common one is small bowel diarrhea.
Small bowel diarrhea. Okay.
Though our sources also mention that sometimes large bowel diarrhea can occur too.
So if you've got a young puppy or kitten with persistent diarrhea, crypto could be on the list of suspects.
It definitely should be considered, yes.
Let's dig into the causes a bit more. How does it actually spread, and what makes an animal more likely to get sick beyond just being young?
Okay, so the main way this parasite moves from one animal to another is through ingestion of contaminated water or feces. That's the fecal-oral route.
So drinking bad water or...
Yeah. Or direct contact with an infected animal's poop. It can even happen when an animal grooms itself after maybe walking through a contaminated area.
Ah, okay. So hygiene is pretty important then.
Very important. For a pet owner listening, this means being extra careful, cleaning up feces promptly, especially in yards or litter boxes, and avoiding potentially contaminated water sources like puddles or stagnant ponds. These are good preventative steps.
Makes sense. And are there specific types of Cryptosporidium that target dogs versus cats?
Yes, our information points to C. canis as the primary species affecting dogs, and C. felis as the main one in cats.
Canis for dogs, Felis for cats. Easy enough.
Right? And apparently they look very similar under the microscope, and they're generally pretty host-specific.
Meaning C. canis mostly sticks to dogs, C. felis to cats.
Generally, yes. However, they also mention another species, C. parvum.
Okay.
C. parvum has a much broader host range. It can infect various species, including humans.
Oh, interesting. So there is some potential for cross-species infection then, zoonotic potential.
There is, yes. Though C. canis and C. felis are less commonly reported in humans compared to C. parvum. But you mentioned what makes an animal more likely to get sick.
Yeah, besides age.
Well, it sounds like in cats, there's usually another major factor at play when they actually get sick.
Oh, what's that?
Our sources really emphasize that almost all the reported cases of clinical cryptosporidiosis, the ones causing illness in cats, occur in those with weakened immune systems.
Ah, immunocompromised cats.
Exactly. It really highlights that a compromised immune system is like a major gateway for this parasite to cause significant illness, not just a passing infection.
Okay, so what are some of the common things that might weaken a pet's immunity like that?
Well, in cats, feline leukemia virus, SLV, is a big one, that really suppresses the immune system.
Right, FLV.
In dogs, things like canine distemper virus or canine parvovirus are known culprits for weakening immunity.
Parvo, yeah, that makes sense.
And it's also worth noting that intestinal lymphoma, that's a type of cancer affecting the gut, can weaken immunity in both cats and dogs, making them more susceptible to crypto.
So underlying health issues are a major risk factor.
Definitely. So putting it together, in an otherwise healthy adult animal, crypto might just be a relatively short-lived issue, maybe even no symptoms at all.
That's the general picture, yes. In animals with healthy immune systems, the infection might be asymptomatic or cause mild, self-limiting signs. The animal might shed oocysts in their feces for about 2 weeks, and then their body usually clears the infection on its own.
Okay.
But as we've discussed, in those immunocompromised animals, it can lead to more severe and persistent inflammation of the intestines, enteritis, and potentially that spread to other organs we talked about.
You know, the liver, gallbladder.
Right, which really underscores why getting a proper diagnosis is so critical. If a pet has these symptoms, especially persistent diarrhea, how do vets actually pinpoint Cryptosporidium as the culprit, especially with all the other things that cause diarrhea?
That can be a bit challenging, you're right.
Right.
Because the main symptom, diarrhea, can have, well, a whole host of underlying causes.
Yeah, I imagine.
Our sources provide pretty extensive list of other conditions that can look very similar. Things like just eating something they shouldn't, dietary intolerance, reactions to medications like antibiotics, maybe toxins like lead poisoning, other types of parasites like giardia or whipworms,
Yeah, okay.
other infectious agents like parvovirus itself, coronavirus, FIP in cats, salmonella, campylobacter. The list goes on.
Wow.
Even organ diseases, heart, kidney, liver problems, pancreatic issues, or metabolic disorders like Addison's disease or hyperthyroidism in cats. And then, of course, cancer like intestinal lymphoma or inflammatory bowel disease.
That is quite a list of possibilities. So just running standard blood tests isn't usually going to give you a clear yes or no for crypto right away.
Exactly. Routine blood work, like a CBC or biochemistry panel, and urine tests are typically normal. Unless there's an underlying condition weakening the immune system, like maybe kidney disease or FLV, that those tests might pick up.
Okay.
But for crypto itself, you usually need specific tests designed to detect the parasite directly.
Okay, so what are those specialized tests? How do they find these tiny things?
Well, our sources point out that the usual fecal flotation method vets use for finding many common intestinal parasites, often using a salt solution, frequently misses Cryptosporidium
Why is that?
because their oocysts are just incredibly small, only about 5 micrometers in diameter, really tiny.
5 micrometers. Okay, yeah, that's small. So what works better?
More effective methods involve using flotation solutions made with sugar or zinc sulfate. These need to have a specific density, a specific gravity of 1.18.
Why the specific density?
Think of it like needing just the right density of liquid to make these super tiny, lightweight oocysts float up to the surface so they can be collected and seen under the microscope. The standard salt solutions aren't dense enough.
Okay, that makes sense. And then even if they float, they're hard to see.
They can be. So they usually need to be stained to make them visible.
What kind of stain?
A special stain called modified acid-fast stain is commonly used. It helps to highlight the oocysts, often giving them a characteristic slightly pink or reddish color against a blue or green background.
Right, so flotation, then staining. Are there other ways?
Yes, there are also fecal antigen tests available. These look for specific proteins produced by the Cryptosporidium parasite itself. Think of it like a test strip looking for a specific marker.
Like some rapid tests.
Exactly. Examples mentioned were the Prospect Cryptosporidium microtiter assay and the ColorView Cryptosporidium test. And some labs use fluorescent antibody techniques too.
Fluorescent, how does that work?
They use special antibodies tagged with fluorescent dyes that specifically bind to the Cryptosporidium oocysts. When viewed under a special microscope, the parasites literally glow, making them easier to spot. Meridian Diagnostics was mentioned as providing this.
Cool. Okay, so several diagnostic options beyond basic flotation. What if a vet needs to send a fecal sample out to one of these specialized labs? Any special handling required?
Yes, that's important. If you're sending a fecal sample off for testing, it's recommended to mix it with formalin, usually a 10% formalin solution.
Formalin. Why?
It's typically mixed in a ratio of about 1 part formalin to 9 parts feces. The main reason is safety. The formalin inactivates the oocysts, making them non-infectious for the lab personnel handling the sample.
Ah, good point. Protect the lab staff.
Exactly. And our sources also highlight PCR tests, polymerase chain reaction.
PCR, yeah, we hear about that a lot now.
Right. These tests look for the parasite's specific genetic material, its DNA. They're available at certain diagnostic labs, like the one mentioned at Michigan State Animal Disease Diagnostic Laboratory.
And are they better?
They're often much more sensitive, especially for diagnosing cryptosporidiosis in cats. The source material said potentially 10 to 100 times more sensitive than some other methods.
Wow, 10 to 100 times.
Yeah, so they can detect even very small amounts of the parasite, which can really improve the accuracy of diagnosis, especially in cases where shedding might be low or intermittent.
That makes sense, especially if the animal isn't shedding huge numbers of oocysts. Now, shifting gears slightly. If an animal sadly doesn't survive, and Cryptosporidium is suspected, what might a vet or pathologist see during a post-mortem examination? What does the damage look like?
Okay, looking at the gross lesions, meaning what you can see with the naked eye, a pathologist might find enlarged mesenteric lymph nodes.
Those are the lymph nodes near the intestines.
That's right, the ones that drain the intestines.
Right.
They might be swollen due to the inflammation and immune response. Also, the lining of the intestine itself, the mucosa, particularly in the lower part of the small intestine, the ileum, might look very red and inflamed hyperemic. The sources also stress something important here, the need to preserve tissue samples very quickly after death.
Why the rush?
Because the intestinal lining undergoes autolysis, or self-digestion, very rapidly after death. And the parasites themselves, being right on the surface, can degrade quickly too. So prompt fixation, using solutions like Bouwens or formalin, is crucial to get good samples for microscopic examination.
Got it. Preserve the evidence quickly. And what about under the microscope? What are the microscopic lesions?
Microscopically, some key signs include something called villus atrophy.
Villus atrophy.
Yeah, imagine your intestinal lining has all these tiny finger-like projections called villi that vastly increase the surface area for absorbing nutrients. This parasite damages those villi, making them shorter and blunter, sometimes even flattening them out. That reduces the gut's ability to absorb nutrients and water, which is a major reason for the diarrhea.
Ah, makes sense. Less absorption equals diarrhea.
Exactly. You might also see reactive lymphoid tissue within the gut wall, which is basically the immune system gearing up, and infiltrates of inflammatory cells like lymphocytes and plasma cells in the layer just beneath the surface, the lamina propria.
So clear signs of inflammation and damage.
Yes. And while the parasites can sometimes be found throughout the intestines, they tend to be most concentrated in the distal small intestine, that lower section.
Okay. So diagnosing this can involve looking closely at feces using various techniques and, in some sad cases, examining tissues post-mortem. What about treatment then? Once it's diagnosed, what can be done?
Well, the good news is that treatment is usually done on an outpatient basis. Your pet likely won't need to be hospitalized unless they're severely dehydrated or have serious underlying issues.
Okay, that's reassuring.
And especially for those immunocompetent animals, the ones with healthy immune systems, the diarrhea is often mild and self-limiting. It might resolve on its own without specific antiparasitic drugs.
So just supportive care.
Supportive care is really the cornerstone, particularly initially. This can include simple things like withholding food for maybe 24 to 48 hours just to give the gut a rest.
Okay.
For milder cases of dehydration from the diarrhea, oral glucose electrolyte solutions like pediatric rehydration fluids can sometimes help replace lost fluids and salts.
And for more severe cases?
If the diarrhea is severe and causing significant dehydration, then parenteral fluids, meaning fluids given under the skin or directly into a vein, IV fluids, might be necessary. Sometimes potassium needs to be added to these fluids because a lot can be lost with diarrhea.
Right, replenish fluids and electrolytes. Are there specific drugs that actually target the Cryptosporidium parasite itself?
Yes, our sources mention a few medications that have been used, though none are universally perfect or perhaps fully approved for this specific use in all regions. One is paramomycin.
Paramomycin. What is that?
It's an aminoglycoside antibiotic given
Hmm.
orally. The dosage mentioned was quite high, 125 to 165 milligrams per kilogram, twice a day for 5 days.
And does it work?
It's reported to have some efficacy, particularly in acute intestinal cases. It seems to help reduce the parasite load.
Any downsides?
Yes, a potential side effect is nephropathy, meaning kidney damage. This seems to be more of a risk in very young animals or those who already have damage to their gastrointestinal barrier, which might allow more of the drug to be absorbed systemically.
Ah, okay. So you have to be careful, monitor kidneys.
Exactly. If toxicity is suspected, stopping the drug and using diuresis, basically flushing the kidneys with IV fluids, and monitoring urine for signs of kidney damage like casts is recommended.
Okay. Any other drug options?
Another one mentioned is tylosin.
Tylosin, that's another antibiotic, right?
Yes, often used for other types of diarrhea. The dose mentioned was 11 millikilogram orally, twice a day, but for a longer duration, 28 days in one reported case involving a cat that also had lymphocytic duodenitis, another intestinal issue,
So longer term use potentially.
potentially based on that report. And then there's nitazoxanide.
Nitazoxanide. That sounds familiar. Isn't it used in humans?
It is, yes. Brand name Alinea. It's an antiprotozoal drug. In pets, the dosage mentioned was 25 milligrams orally, once a day, for anywhere from 7 to 28 days.
And the effect?
It's been reported to stop the shedding of oocysts in the feces of infected cats, so it seems to interrupt that part of the cycle.
Any issues with that one?
A common side effect seems to be vomiting. If that happens, it might need to be managed with antiemetic drugs, like chlorpromazine was mentioned.
Okay.
But our sources also cautioned that this drug needs further evaluation. Its use in cats and dogs for crypto seems somewhat limited so far, so more studies might be needed to really understand its effectiveness and safety profile.
Right. So it sounds like treatment isn't always straightforward, kind of depends on the individual animal, the severity, and maybe underlying conditions.
That's a good way to put it. There's no single magic bullet, it seems. Supportive care is vital, and then specific medications might be chosen based on the case, weighing the potential benefits against the risks.
What happens after treatment? How do vets know if it's actually worked?
Follow-up is important. Primarily, you monitor the clinical signs. Is the diarrhea improving or resolved? Is the animal regaining weight and energy?
Makes sense. Check the patient.
And veterinarians will often recommend rechecking the feces for the presence of oocysts, maybe about 2 weeks after treatment ends, or sooner if the signs aren't improving or they come back.
To see if they're still shedding the parasite.
Exactly. The goal is both clinical resolution, the pet feels better, and ideally parasitological cure, meaning the parasite is gone. Though sometimes stopping the shedding might be difficult, especially in immunocompromised animals.
Right. But what's the general outlook, the prognosis?
Generally, the prognosis is considered excellent if any underlying cause of immunosuppression can be identified and effectively addressed or managed.
Ah, so fixing the root cause is key.
Absolutely. If the immune system can recover, the animal often clears the crypto infection or keeps it well under control. If the immunosuppression can't be fixed, then managing the cryptosporidiosis can be much more challenging long term.
Okay, so let's try to sum this up. We've covered a lot. Cryptosporidiosis is a gastrointestinal illness caused by this tiny parasite, Cryptosporidium.
Right, found worldwide.
It mainly affects dogs and cats, especially the very young ones, or those with weakened immune systems due to other illnesses like FLV or parvo, or even cancer.
Correct. Age and immune status are key risk factors.
The main sign, if there are signs, is usually diarrhea, mostly small bowel, but lots of infections show no signs at all.
Yes, subclinical infection is common.
Diagnosis isn't always simple because diarrhea is so common. It requires specific fecal tests beyond the routine ones, like special flotation, stains, antigen tests, or highly sensitive PCR.
Definitely need those specific tests to confirm it.
And treatment really focuses on supportive care fluids, maybe resting the gut, and sometimes specific antiparasitic drugs like paramomycin or nitazoxanide are used. But they have potential side effects and aren't always necessary, especially in healthy animals.
Supportive care is primary, and addressing any underlying immune issues is crucial for the prognosis.
Which is generally excellent if that underlying cause can be managed.
That's a pretty solid summary. It's a very common parasite out there, and while, many animals handle it without serious issues, it's definitely something pet owners, especially those with young pets or pets with other health problems, need to be aware of.
It really makes you think, doesn't it? Given how widespread Cryptosporidium is, just sort of lurking in the environment, what other seemingly minor things in our surroundings could be having these significant yet often unseen impacts on the health of our animals and maybe even ourselves?
That's a really interesting point.
It just highlights how interconnected everything is. Our pets' health, our health, the environment we all share, definitely something to ponder. Thanks for shedding so much light on this tiny troublemaker today.
My pleasure. It's an important topic.